Having shoulder pain can affect how you function and feel. So for this week's Where It Hurts segment, we're partnering with Dr. Vishal Mehta to highlight shoulder pain and our options to treat it.
Shoulder pain is extremely common. We're seeing a lot of shoulder pain in our youth in general, but particularly our youth athletes. And we're seeing a lot of shoulder issues in our older population. And part of that is, as the population ages in general, rotator cuff tears have just become ubiquitous.
If you do experience shoulder pain, it's important to keep track of the cause and symptoms.
The two most important things to pay attention to are the acuity, so did it happen all of a sudden or did it happen gradually? And then the dysfunction. Can they no longer lift their arm where they could before? If you have an acute injury and dysfunction, then you've got to worry that something's wrong. The other thing that is always concerning is progressive pain. You shouldn't really wait on that. You can give it a couple weeks to see if it turns around, but you should really see a doctor.
For Susan Harney, shoulder pain increased gradually over the years and eventually became unbearable.
I call it a bloom of pain, and it just is, it feels like there's something glowing in my shoulder, and then it just spreads. I love to hike. It impacted my hiking because you swing your arms, you carry things, and that just hurts. Because it's so constant, it drains you of energy and it drains you of the joy of doing things that you love.
Susan was determined to find relief and was referred to Dr. Vishal Mehta at Fox Valley Orthopedics.
We could see from her x-rays that she had pretty advanced shoulder arthritis. We then took the next step to get an MRI to look at the quality of her rotator cuff and see if there was anything else going on.
Armed with information gathered from tests and conversations with Susan, Dr. Mehta presented multiple options for treatment.
One side of the spectrum is conservative with activity modifications. The other side of the spectrum is typically the most aggressive treatment, which in her case is a shoulder replacement. And then we talk about the options in between: anti-inflammatories, injections. It's really a relationship that develops, and we're constantly talking about options.
I trusted him, and so I trusted his opinion.
Susan and Dr. Mehta concluded that surgery would be the best option. After a total shoulder replacement, Susan was able to recover in the comfort of her home and begin her road to recovery.
The surgery is just part of it. The rest of it is making sure that we follow the correct rehab from start to finish.
It progressed perfectly. By the end of that period of physical therapy, I had a full range of motion that was equal to what I had before. Today, I'm free of pain, and that is a gift and a blessing. I can do anything that I did before, and that's an incredible feeling.
She's doing amazingly well. She's happy, she's enjoying her retirement, she's sleeping well. So there's nothing more rewarding than to take that patient, to figure out what's going on, and to get them back where they want to be so that they can enjoy their lives and move on.
As Susan's story shows, there is help for those with debilitating shoulder pain. There are many options for pain relief, so it's important to work with your doctor to find the best solution for you.
Communication with patients is key. With that, patients do very well. They have a complete understanding of what to expect, and they recover very well.
If you struggle with shoulder pain and want to know more about your options, contact Dr. Vishal Mehta and his team today.